If you're experiencing symptoms such as itching, discharge, or discomfort, it's essential to address the issue promptly and effectively. What causes vaginal infections? A vaginal infection is an inflammation or infection of the vaginal area, often resulting in symptoms such as itching, burning, discharge, and discomfort. The common causes include yeast infections. These are caused by an overgrowth of a fungus called Candida, leading to itching, burning, and thick, white discharge. Sexually transmitted infections, STIs. Infections spread through sexual contact, such as chlamydia or gonorrhea, can lead to vaginal infections with symptoms like unusual discharge or pain. Hormonal changes. Fluctuations in hormone levels, such as during pregnancy or menopause, can alter the vaginal environment and make it more prone to infections. Irritants. Chemicals in products like soaps, sanitary pads, or scented tampons can irritate the vaginal area and lead to infections. Immune system issues. A weakened immune system, due to conditions like diabetes or HIV, can make it easier for infections to develop and persist. Diagnosing vaginal infections. Diagnosing vaginal infections usually involves evaluating your symptoms, conducting a physical examination and lab tests. Here's an overview of the diagnosing process. 1. Reviewing medical history and symptoms. The doctor will ask you about your symptoms, including the duration and severity of any discomfort, discharge, or itching. They'll also review any recent changes in your health or lifestyle. 2. Physical examination. A pelvic examination is conducted by the doctor to inspect the vaginal area for signs of infection, such as unusual discharge, redness, or swelling. They may use a speculum to view the inside of the vagina and cervix. 3. Laboratory tests. Microscopic examination. A sample of vaginal discharge is examined under a microscope to identify the presence of yeast, bacteria, or other abnormalities. Culture tests. Discharge samples may be cultured to identify specific bacteria or fungi and determine the best course of treatment. pH testing. Measuring the vaginal pH can help distinguish between bacterial vaginosis, yeast infections, and other conditions. 4. STI testing. If a sexually transmitted infection is suspected, specific tests for STIs may be conducted, which can include urine tests, swabs, or blood tests. Treatment of vaginal infections. Treating vaginal infections effectively depends on what's causing them. Here's a simple guide to common treatments for different types of infections. 1. Bacterial vaginosis, BV, antibiotics. Your doctor might give you pills like metronidazole or clindamycin. There are also gels you can apply directly. Avoid irritants. Try not to use douches or scented products, as they can make things worse. 2. Yeast infections. Antifungal medications. You can use over-the-counter creams or suppositories like miconazole or clotrimazole. For critical cases, a doctor might prescribe oral medication like fluconazole. Lifestyle changes. Wear cotton underwear and keep things dry to prevent future infections. 3. Sexually transmitted infections, STIs, antibiotics or antivirals. Treatment depends on the STI. For instance, chlamydia and gonorrhea are treated with antibiotics, while herpes needs antiviral medication. Partner treatment. It's important for both partners to get tested and treated to avoid passing the infection back and forth. 4. Hormonal changes. Hormone replacement therapy. If hormonal changes are causing issues, like during menopause, hormone therapy might help. Vaginal moisturizers. These can help with dryness and discomfort caused by hormonal changes. 5. Irritants. Avoid triggers. Stay away from things like certain soaps, laundry detergents, or feminine hygiene products that might irritate. 6. Vaginal infection remedies. Good hygiene. Use mild, unscented soap and water for washing. Healthy lifestyle. Eating well and staying healthy can help your immune system fight off infections. How to prevent vaginal infections. Preventing vaginal infections involves a combination of good hygiene practices, lifestyle adjustments, and mindful choices. Here are some effective strategies following which you can prevent vaginal infections. 1. Maintain good hygiene. Gentle cleansing. Use mild, unscented soap and water to clean the external genital area. Avoid douching, which can disrupt the natural balance of bacteria and yeast. Proper wiping. Always wipe from front to back after using the toilet to prevent bacteria from spreading from the anus to the vagina. 2. Wear appropriate clothing. Breathable fabrics. Opt for cotton underwear and avoid tight-fitting clothes to allow air circulation and reduce moisture buildup. Change wet clothing. Promptly change out of wet swimwear or workout clothes to minimize moisture, which can promote yeast growth. 3. Practice safe sex. Use protection. Condoms can help reduce the risk of sexually transmitted infections, STIs, and maintain vaginal health. Regular testing. Get tested for STIs regularly and ensure that partners do the same to prevent infections. 4. Avoid irritants. Skip scented products. Avoid scented tampons, pads, and feminine hygiene sprays, which can irritate the vaginal area. Choose gentle products. Opt for hypoallergenic and fragrance-free products for washing and laundry. 5. Maintain a healthy lifestyle. Balanced diet. Eat a diet rich in fruits, vegetables, and probiotics to support a healthy immune system and vaginal flora. Stay hydrated. Drink plenty of water to help flush out toxins and support overall health. 6. Manage health conditions. Diabetes management. Keep blood sugar levels under control if you have diabetes, as high sugar levels can increase the risk of yeast infections. Monitor hormonal changes. Address hormonal imbalances with your healthcare provider to maintain vaginal health. By incorporating these practices into your routine, you can significantly reduce the risk of developing vaginal infections and explore effective vaginal infection remedies to promote overall reproductive health.